Hello guys, welcome to my channel PhysioSaurus. In this today's video, I'm going to talk about the mobilization. Now this video is going to be a very important video for all of my viewers. Okay, so make sure to watch this video till the very end. Now let me just give you an overview on what we are going to discuss about this topic, that is mobilization. Okay, now before I proceed with the synopsis or subheadings from this video only, I must tell you that this video is specifically about mobilization. Okay, this video is not at all about the manipulation part. Now, if you guys don't know about the difference between mobilization or manipulation, I have given a video link in the description box. Okay, a few days back or maybe a week ago, I have uploaded a video discussing the similarities or the differences between manipulation and mobilization. So make sure to watch that video and then you should watch this video instead. Okay. Now let me just give you an overview on what we are going to discuss in this video. So at first we'll talk about the classification. Okay. Now Mulligan has a lot of classification based on thrust and non-thrust techniques. That is your Maitland and Carlton bone that we will discuss. Okay. The next thing is that basic concept. And believe me, if you understand this basic concept, your clinical skills will be improved, and in academics also you will be better. All right, now the third thing is osteokinematics and arthrokinematics. Okay, so osteokinematics and arthrokinematics, the knowledge of this both term plays a very important role in understanding mobilization, so that we are going to discuss in this video. The next one is its relation with the biomechanics. Okay, the next point is how to determine the direction of mobilizing force. Now let's say that a patient comes to you saying that his range of extension does not go beyond 10 degrees or 20 degrees or 30 degrees. So in that particular case, how would you determine that in which direction you should apply the mobilizing force? So that also we will discuss in this video only. Then I'm going to talk about the example of arthrokinematic motion in the biomechanics. Okay, I'll just give you a few more examples so that you understand the whole basic concept behind it. Okay, now the next point is effect of the joint motion, that is your arthrokinematic motion. Okay, which is also very important that you must know about it. Then we'll deal about the indication, uses and limitations of the mobilization, including its examination or evaluation that physiotherapists do before performing the mobilization. The next thing is contraindication and precaution. Then comes the positioning and stabilizing part. That is the most important part in the mobilization. Okay. Then comes the treatment plane, which is again one of the most important topic in mobilization. And in the end, I'll deal about the doses of the mobilization, in which we will talk about the Maitland and the Carlton bone specifically and discussing about the difference between them. Okay, and in the end we'll talk about the initiation and the progression of treatment with mobilization, and then we'll talk about the MWM, which is nothing but Mulligan concept. So this will be our framework to this video, and I'm going to discuss every point that I have just said right now in detail. Okay, so make sure to watch this video till the very end, and if you guys have any doubt, any kinds of doubt, please let me know in the comment section. All the references are taken from the Kistner book. If you guys don't have Kistner book, you could just directly download the PDF from my Telegram channel. Link is already given. Thank you so much. Bye-bye. So first, let's talk about the classification of mobilization. Okay. So mobilization is classified under thrust mobilization and non-thrust mobilization. In thrust mobilization, it is grade 5 of mobilization, so it is known as manipulation or high velocity thrust, HVT. Okay, but in non-thrust mobilization, it contains two types of techniques, which is your non-thrust oscillation techniques and non-thrust sustained joint plate techniques. Okay, so which is again known as your Maitland grade and Carlton bone grade. Okay, now the thing is, we will discuss about Maitland and Carlton bone gradings in the upcoming videos, but not right now. Okay, so it will be discussed later on. All right, now there are some other categories in the mobilization, and these categories are self mobilization and Mulligan concept. Okay, so self mobilization is more of a self stretching techniques, and we will talk about it in detail in the upcoming videos, especially about the MWM, alright, which is your mulligan. Now let's talk about the mobilization concept. Now if you want to understand the concept of mobilization, you need to understand what is kinematics, alright. So kinematics is of two types, osteokinematics and arthrokinematics. Since osteo means bones and kinematics means movement, so osteokinematic means movement of the bone. For example, flexion, extension, abduction, adduction, etc. Alright. Now, this osteokinematics is also known as physiological motion. Okay. The second type of kinematics is arthrokinematics. Now, arthro means joint. Alright. So, movement which occurs at the level of joint surfaces is known as arthrokinematics. The another name for arthrokinematics is accessory motion. Now, we will discuss about this accessory motion in detail. Okay. Because mobilization concept is totally based on this accessory motion. Alright. So before I talk about this accessory motion, you need to understand the shape of the joint. Okay. So as you know that a joint is composed of two bones. Alright. So the articular surfaces of both the bones are either concave or either convex. Okay. So that means whenever you will perform flexion or extension, that means that either concave or either convex surface will move on convex or concave. Okay. So basically concave surface and convex surface moves over each other. For example, in glenohumeral joint, the articular surfaces of the scapula is concave in shape. Okay. But the articular surfaces of humerus head is of convex in shape. Alright. So this one is the prime example of the concave convex structure. Alright. Now let's talk about this arthrokinematics. Alright. So arthrokinematics is again of two types, component motion and joint play motion. Okay. In joint play motion, there are 5 types of motion which occurs as a joint play motion, which is your rolling, sliding, spinning, traction and compression. Okay. But the example of component motion is when you perform the shoulder flexion, there are 2 other movement which occurs with shoulder flexion, and those 2 movement are upper rotation of scapula and rotation of clavicle. Alright. The another example for component motion is when you perform the ankle motion, fibular rotation also occurs. Okay. Now let's talk about these joint play motions. Okay. So the first joint play motion is rolling. A prime example of rolling is, let's take a ball and just slide it on the oblique surface, just like in this diagram. Okay. So here, as you can see here in this diagram, that the surface of the ball is convex in shape. Okay. And this oblique surface is more of a plane in shape. Alright. So as you can see here, the surfaces, both the surfaces are incongruent. They are not congruent. Okay. And new points of one surface meets with new points of another surface. तो बेसिकली अगर हम इसको डिटेल में अगर हम लोग इसको समझें, तो जब भी बॉल अगर रोल कर रहा है, इसका अगर हम लोग 4 पॉइंट मान लें, 1 2 3 4, ठीक है, और ये अगर इंक्लाइंड प्लेन है, तो अगर आप देखेंगे कि जो बॉल का हर एक जो सरफेस पे अगर हम लोग एक पॉइंट मान लें, तो नया पॉइंट हर बार इस ऑब्लिक वाले सरफेस के नए पॉइंट के साथ मिल रहा है. ओके. सो दैट मीन्स new points of one surface meets with new points of another surface. Okay. And it always happens in the same direction as the swinging bone. तो बेसिकली जिस डायरेक्शन में बोन आपका मूव कर रहा है, उसी डायरेक्शन में रोलिंग भी परफॉर्म होता है, चाहे सरफेस कनकेव हो चाहे कन्वेक्स हो, इससे फर्क नहीं पड़ता. जैसे फॉर एग्जाम्पल, व्हेन यू परफॉर्म शोल्डर फ्लेक्शन, ह्यूमरस मूव्स एंटीरियरली, सो रोलिंग अकर्स इन द एंटीरियर डायरेक्शन. Alright. Now, the next joint play motion is sliding or gliding. Okay. So it is more of a translatory motion. Okay. For example, when you just slide a book on the table. Alright. Now, in sliding or gliding, same point of one surface comes in contact with the new points of opposing surface. So as you can see here, मैंने अगर ये बुक को अगर स्लाइड किया है तो बुक का जो सरफेस है, बुक का जो सरफेस जो पॉइंट है, ठीक है, वो सेम ही होगा, लेकिन जो टेबल था, टेबल का जो कांटेक्ट पॉइंट होगा वो हर बार जो बुक के पर्सपेक्टिव में वो चेंज्ड होगा या न्यू होगा. ओके, सो सम सेम पॉइंट of one surface comes in contact with new points on opposing surface. All right. Now the next point. For pure sliding, surfaces must be congruent. तो अगर आप चाहते हो कि प्योरली स्लाइडिंग हो तो सरफेस को बिल्कुल कॉन्ग्रुएंट होना चाहिए. जैसे कि फॉर एग्जांपल अगर आप देखें तो बुक का सरफेस भी नीचे से फ्लैट है पूरा. मान लें ये किताब है और ये इसका नीचे का सरफेस भी पूरा फ्लैट है, और अगर हमको इसको स्लाइड करना हो या ग्लाइड करना हो टेबल पे तो टेबल का सरफेस भी पूरा फ्लैट होना चाहिए. लेकिन रोलिंग में क्या हो रहा था, बॉल का सरफेस जो था वो कन्वेक्स था, लेकिन जहाँ से वो रोल कर रहा था वो सरफेस पूरा प्लेन था. ओके, सो देयर इज अ डिफरेंस. ओके, सो व्हेन कनकेव सरफेस मूव्स ऑन कन्वेक्स सरफेस देन ग्लाइडिंग occurs in the same direction of angular movement of bone. Okay, but when convex surface moves on concave surface then gliding occurs in the opposite direction. Okay, so यही तो है हमारा concave convex rule भी. Okay, चलिए तो इसको अगर हम लोग कंबाइन करें, so when you will combine the rolling and gliding, okay, so here the concept of concave convex rule arises, and that says that when concave surface moves on convex surface then gliding and rolling occurs in the same direction of bone swing. All right, तो जब आपका concave surface convex surface पे move करेगा तो आपका जो gliding होगा और जो rolling होगा दोनों के दोनों same direction में होंगे, उसी direction में जिस direction में आपका bone move कर रहा है. लेकिन when convex surface moves on concave surface then gliding will be in the opposite direction but rolling will be in the same direction. इस डायग्राम से इसको समझते हैं. एज यू कैन सी हियर द एंगुलर मूवमेंट इज इन डाउनवर्ड डायरेक्शन, तो रोलिंग भी हमारा डाउनवर्ड डायरेक्शन में हो रहा है. ठीक है, अब यहाँ पे अगर आप इस पिक्चर को अगर आप गौर से देखें तो आप इसमें पाएंगे कि जो कन्वेक्स सरफेस है जो कि ऊपर वाला है वो कनकेव सरफेस पे मूव कर रहा है. ओके, सो अकॉर्डिंग टू कनकेव कन्वेक्स रूल व्हेन कन्वेक्स सरफेस will move on concave surface then sliding will occur in the opposite direction. Okay, so this is it. तो यहाँ पे क्या होगा, एंगुलर मूवमेंट डाउनवर्ड की तरफ है तो रोलिंग भी डाउनवर्ड होगा, लेकिन जो स्लाइडिंग होगा वो अपवर्ड डायरेक्शन में होगा. ओके, सेकेंड एग्जाम्पल को अगर हम लोग लें तो यहाँ पे अगर आप देखें तो कनकेव सरफेस आपका मूव कर रहा है कन्वेक्स सरफेस पे, और जो एंगुलर मूवमेंट है वो अगेन नीचे की तरफ है, तो रोलिंग फिर से नीचे की तरफ हो जाएगा, लेकिन इस बार स्लाइडिंग भी नीचे की तरफ होगा क्योंकि कनकेव सरफेस इज मूविंग ऑन कन्वेक्स सरफेस. सो दिस इज इट, दिस इज ऑल अबाउट द कनकेव कन्वेक्स रूल. नाउ इन मोबिलाइजेशन what you do is you perform sliding of the joint. Okay, you never perform rolling, and there is a reason behind that, because when you perform rolling it will cause joint compression which you don't want. Okay, and in normal joint mechanics rolling without gliding it does not occur. So here is the two reason why you don't perform rolling and why you should perform sliding. Okay, now the next thing is spinning movement. So spinning means obviously there would be an axis and the rotation will be around an axis. So in spinning movement, rotation movement occurs around the axis and it occurs as the combination of rolling and sliding. Okay, and it very rarely it happens. For example, in radiohumeral joint with pronation and supination movement. Okay, and it also happens in scapulohumeral joint and your pelvifemoral joint. All right, so the diagrams of these are given here. Okay, so this one is the pelvifemoral joint, this one is your humeroradial joint, and this one is the scapulohumeral joint. All right, so this is your spinning movement and this one is the axis of the rotation movement, and here as you can see rotation movement is happening. All right, now let's move on to compression part. So what is compression? So in compression there is decreased joint space, okay, and it occurs as the result of rolling, which we have already discussed, and this is the prime reason why we don't apply rolling movement, okay, in the mobilization. Now whenever you will perform weight bearing activity, so at that time compression of the joint surfaces occur, okay, and compression of the joint also occur due to muscle contraction, which will provide the stability to the joint. All right. Now the fifth one, which is your traction or distraction. Now let me tell you something. Traction and distraction, they are not at all synonymous, okay. There is a vast difference between them. So traction means longitudinal pull, okay. So as you can see here, this one is the longitudinal pull, so it is traction. So when you will pull the humerus bone inferiorly, so you are basically providing traction to the joint. But distraction means separation or pulling apart. So distraction, look at this second figure here, distraction is in this direction, but in the first figure distraction is in inferior direction, okay. Now separation of the joint surfaces or distraction does not always occur when a traction force is applied to the long axis of the bone, okay. For example, if traction is applied to the shaft of humerus when the arm is at side, it results in the gliding of the joint surface, okay. But distraction of the glenohumeral joint requires a force that is applied at right angles to the glenoid fossa, which you can already see, okay. So here if you are providing force in this direction, you are basically applying force at the 90 degree, all right. So this is the difference which you should always keep in your mind, all right. Now this is why, for clarity, whenever there is pulling on the long axis of the bone, you call it long axis traction, okay. So don't get confused between these terms, all right. Okay, so the next thing is a special note which you should always keep in your mind. So basically mobilization is always performed in the non-weight bearing position unless and until you are performing MWM or Mulligan concept, okay, which is a whole new concept and I'll talk about it in the upcoming videos, all right. So keep this in mind. Now let's talk about this direction of mobilizing force with some examples. Now here is something that I want you to know कि मैं आने वाले टाइम पे ना हर एक जॉइंट का हर एक मूवमेंट के साथ जो आपका डायरेक्शन होगा मोबिलाइजिंग फोर्स का, उसका एक चार्ट बना करके, उसका चार्ट प्रिपेयर करके वो मैं आपको पूरा अच्छे से एक्सप्लेन कर दूंगा। इस वीडियो में मैंने कुछ एग्जांपल लिया है ताकि उस एग्जांपल से मैं आपको समझा सकूं कि इसका बायोमैकेनिक्स में क्या रेलेवेंस है या क्या रिलेशन है। तो ये रेलेवेंस को या रिलेशन को समझाने के लिए ये सारे एग्जांपल्स लिए गए हैं, बट नेक्स्ट वीडियो जब मैं अपलोड करूंगा तो उसमें मैं एक चार्ट बना करके और सारी बातें, जैसे कि अगर शोल्डर जॉइंट का एबडक्शन अगर आपको करना है मोबिलाइजेशन के लिए तो आपको कौन से डायरेक्शन में ग्लाइडिंग देना है, तो वो एक चार्ट बना करके मैं प्रिपेयर करके आपको समझाने की कोशिश करूंगा, ठीक है। तो ये इस वीडियो में पहले तो ये समझ लीजिए कि बायोमैकेनिक्स से इसका क्या रेलेवेंस है या क्या रिलेशन है। तो पहला एग्जांपल है हमारा शोल्डर। तो एबडक्शन के लिए हम लोग करते हैं इन्फीरियर ग्लाइडिंग, फ्लेक्शन इंटरनल रोटेशन के लिए हम लोग करते हैं पोस्टीरियर ग्लाइडिंग, एक्सटेंशन और एक्सटर्नल रोटेशन फॉर दैट वी डू एंटीरियर ग्लाइडिंग, ओके। फॉर ह्यूमरोरेडियल जॉइंट, फॉर फ्लेक्शन वी डू एंटीरियर ग्लाइडिंग, फॉर एक्सटेंशन वी do posterior gliding. For knee joint in non-weight bearing position, for flexion we do posterior gliding of the tibia and for extension we do anterior gliding of the tibia. For hip joint, okay, for hip joint flexion and internal rotation के लिए posterior gliding, extension and external rotation के लिए anterior gliding. Now let's talk about the relation between biomechanics, okay, with the direction of mobilizing force. So as you all know guys that in biomechanics kinematics is very important, right? So now you can understand the relation between biomechanics and this mobilizing force, okay. तो mobilizing force अगर मैं anterior gliding अगर मैं कह रहा हूँ तो ये कहाँ से आ रहा है, अब थोड़ा आपको आइडिया लग रहा होगा। जैसे कि इन बायोमैकेनिक्स वी रीड अबाउट द काइनेमेटिक्स. नाउ अगेन काइनेमेटिक्स इज ऑफ टू टाइप्स, ऑस्टियो एंड ऑर्थ्रोकाइनेमेटिक्स. ओके, so this arthrokinematics which you study in the biomechanics, it determines the direction of the mobilizing force. Okay, जैसे कि फॉर एग्जाम्पल इन शोल्डर, अगर मैं शोल्डर एबडक्शन की अगर मैं बात करूं तो उसका अगर आप काइनेमेटिक्स देखेंगे तो उसके काइनेमेटिक्स में लिखा होता है देयर इज इंफीरियर ग्लाइडिंग. सो व्हेन यू परफॉर्म द एबडक्शन ऑफ द शोल्डर देयर इज इंफीरियर ग्लाइडिंग. व्हेन यू परफॉर्म फ्लेक्शन और इंटरनल रोटेशन ऑफ द शोल्डर देयर इज पोस्टीरियर ग्लाइडिंग. When you perform extension or external rotation of shoulder, there is anterior gliding. तो अगर आप देखें तो आप ये पाएंगे कि दोनों के दोनों सेम चीज़ ही हैं. तो अगर आपको अब समझ में आ रहा होगा कि दोनों का रिलेशन क्या है, और अगर कभी अगर याद आपको ना आए तो एक बार बायोमैकेनिक्स जरूर उल्टा करके देख लीजिएगा. ओके, सो दिस इज इट. सो इस वीडियो में फिलहाल इतना ही. आने वाले वीडियोस में मैं इफेक्ट ऑफ जॉइंट मोशन के बारे में भी बात करूंगा, इंडिकेशन, कॉन्ट्रा इंडिकेशन, ये सारी चीज़ों के बारे में बात करूंगा. ओके, सो थैंक यू सो मच फॉर वॉचिंग दिस वीडियो. आई होप कि आपको ये वीडियो अच्छा लगा हो. तो वीडियो को अपने लोगों के साथ शेयर कीजिए, बैचमेट के साथ शेयर कीजिए, और वीडियो को लाइक करना मत भूलिए.